Early intervention in disability management changes lives for the better. When we act early with the right support at the right time, individuals can recover more quickly, return to work with confidence, and regain their sense of purpose, independence, and financial security. Employers retain skilled, motivated staff, reduce disability costs, and build more inclusive, resilient workplaces. Families stay stable, communities stay connected, and people thrive. Your health is your greatest wealth. It allows you to move freely, work where you want, and thrive. But that can all change in an instant. Acquiring a disability gravely threatens your chances for gainful employment, financial independence, and self-determination. People with a disability are often stripped of their dignity, autonomy, social inclusion, and independence. There's also a subtle and dangerous tendency to gradually become accustomed to a life of immobility and dependence. Physical impairments often result in mental health challenges within 6 months. About 75% of people develop depression, anxiety, and other crippling states after a life-altering injury or illness. Many lose confidence in themselves and their chances of getting back to some version of their old lives. Thinking about returning to work feels harder and harder as declining conditions of existence start to feel more and more normal. Savings dry up, housing becomes unaffordable, and bills go unpaid. Once a person with a disability loses their attachment to the workplace and ends up on disability assistance, less than 1% will ever enter the workforce again. Their lives devolve in a spiral of endless paperwork to prove both their physical and financial need. Hospital records, doctor's notes, program applications, reports on the smallest financial support, all so they can apply for access to their most basic needs, like housing, medication, transportation, equipment, and personal care. Often, these needs go unmet. Poverty and disability practically go hand in hand. In Canada, there are at least 1.4 million disabled people living in poverty today. So many are left feeling cold, hungry, in debt, and abandoned. The high suicide rate among disabled people is truly shocking. The tragedy of disability affects everyone: the individual, their family, their community, and their employer. It impacts millions of people and billions of dollars in the economy. But there is hope through early intervention. In their moment of vulnerability, a disabled worker needs a trusted expert to help them navigate the complexities of providing the right resources at the right time in order to support them back into their social and working spheres. Early intervention is a proactive approach to support individuals facing a life-altering injury or illness by providing the right resources, guidance, and expertise at the critical moment of need. Its goal is to minimize disruption, prevent long-term consequences, and facilitate a timely return to work and social engagement, often before the individual has to take extended time off. Returning to work rather than getting pushed onto a benefits program or long-term disability allows people to get back their sense of purpose and pride in having an income and being able to provide for themselves and their families. There's also a net benefit for the employer, who gets to retain their talent rather than have to pay replacement and training costs. And by making reasonable accommodations to welcome back their employee, they also see reduced claim durations and lower long-term disability rates. Employment is a social determinant of health. Putting in the work to intervene early, collaborate on solutions, and see employees return to their pre-disability employer has a proven 5-to-1 rate of return on investment for the employer and huge returns on social health for everyone. Employers have nothing to lose and everything to gain, and they don't have to do it alone. There are tools and access to professionals through the National Institute of Disability Management and Research, and education that's specific to return-to-work programs is available through the Pacific Coast University for Workplace Health Sciences. For individuals, you can act quickly with the guidance of a certified disability management professional to work with you, speak on your behalf, and navigate the bureaucratic and emotional waters of returning to work after an illness or injury. Empower yourself or someone you know by accessing the support and resources needed to stay connected to life, work, and community. Whether you're an employer ready to support your team, an employee seeking guidance, or a professional with expertise to share, be a part of the growing movement around early intervention in disability management. Get involved, make a difference, and help create a future where everyone can thrive.
Could you imagine losing 690 years of productivity? Well, that's what happened in 2019 because there was over 250,000 occupational lost time injury claims in Canada. At minimum, that works out to be at least 690 years of lost time. In 2014, the cost of disability-related absence was 2.4% of Canada's gross national payroll. That's $16.6 billion. With that kind of money, you could buy Pearson International Airport 3 times and still have $1 billion left over. In any given week, at least 500,000 employed Canadians are unable to work due to mental health problems. That's almost the population of Vancouver, British Columbia, every week. And that economic burden is estimated at $51 billion each year. That's 10 international airports and $1 billion left over. Locally and globally, we're facing a massive economic, social, and public policy problem around injury and disability. The impact is not just limited to the injured and disabled employee, it also affects their families, their friends, and their coworkers. The net impact rapidly measures into millions of people and billions of dollars in the economy. So, how do we change this? How do we catch the people who are falling through the cracks and recapture all that lost time and capital? Well, the answer is in having an effective disability management program. To get an employer's perspective, we talked to Leslie Allen Reed, the Director of Absence and Disability Management at Fraser Health.
Disability management is both a cost avoidance and a retention strategy for employers. So your cost avoidance comes from reducing the cost of employees being off work. The most expensive part of a disability is the time lost from the workplace. Not only are you paying for that employee who's off, you may be covering them with sick leave or a short-term or long-term disability, WorkSafe BC coverage. You're also having to replace that worker in the workplace. And sometimes you have to do that at overtime rates. So not only are you're basically paying for 2 people, possibly 2.5. And if you don't replace that person, then you've lost the productivity of that worker. So if I can help that person recover and get back to work more quickly by doing the right things at the right time to support their recovery, that time loss from work is less, and your cost associated with that becomes less. From a retention point of view, your people are your most important investment. And so if you have a strong disability management program, when one of those important resources gets hurt, gets sick, gets injured, and you're helping them get back to work in a timely way, they're going to see that as being valued by the organization. And that retention of that person, that skilled worker, that knowledgeable person who knows your work and business and has that experience, then is better for you business-wise. It's probably easiest for me to give you an example in real life. So at Fraser Health, we did some redesigning of our DM program a couple of years ago with a focus on early intervention for musculoskeletal and mental health issues, really trying to focus on getting people connected with services and supporting return to work as early as possible. We actually improved our return to work percentage of employees that return to work before 150 days, which is the start of our LTD plan, by 20% over 2 years. And so in turn, that reduced our LTD claim rate. When you do the math on trying to determine, well, what does that actually equate to? If our claim rate had stayed the same, we would have had almost 300 additional claims in the system that we avoided by having better outcomes up front and early intervention. And at a place as large as Fraser Health is, that equates to just over $10 million in 2 years.
A savings of $10 million. That's an amazing result simply by using cost avoidance and employee retention strategies through effective disability management practices. Saving money and maintaining your staff are great, but there's also another major thing for organizations to consider in the near future: compliance.
Recognizing the member for Saanich North and the Islands.
This legislation creates a framework that this is a process that's an ongoing process. Future parliaments are going to continue this important work.
We announced a new accessibility regulation taking effect on September 1st that requires over 750 organizations to start establishing accessibility committees, accessibility plans.
Federal and provincial governments are creating legislation like the Accessible British Columbia Act and the Accessible Canada Act. These pieces of legislation require government departments and crown corporations to think about and accommodate persons with disabilities. It is also the future for the private sector. So at this point, I hope employers are asking themselves, how do I get a cost avoidance and employee retention strategy that also brings me into compliance with legislation? Well, the National Institute of Disability Management Research has grants and support for organizations that want to evaluate their accessibility and disability management practices. The best first step with this grant is a snapshot assessment to figure out where the organization stands in relationship to best practices. This process is called the Workplace Disability Management Assessment. And these assessments are open to any type of employer. It doesn't matter what level your disability management practices are at. You just have to be willing to have the conversation, because this assessment covers 16 areas of discussion in 72 questions. They provide a roadmap to either create a disability management program or enhance an existing one. The grant available for the Workplace Disability Management Assessment is incredibly valuable, saving organizations tens of thousands of dollars, and it lays the framework to foster a consistent and engaged disability management process throughout your organization. But what does it actually look like to have effective disability management practices within your organization? We've asked a certified disability management practitioner to talk about her role.
Having a disability management client partner within your organization allows you to have that single source who comes in with a different lens, bringing in knowledge, experience, and impartiality that allows you to have better outcomes for everybody. Human resources is a very structured and rigid role. Disability management comes in with the breadth of understanding of those policies, those procedures, but is trained to have that creativity to color outside the lines and be able to come up with a reasonable accommodation that benefits everyone. Let me give you an example. I worked with a client who had a medical condition that simply stopped her from being able to work a certain part of her schedule. It was quite simple in terms we just wanted to be able to ask if anybody else was willing or interested to change with her. But because of rules, collective agreement, both HR and the union made it very difficult to ask a very simple question. Because it was a reasonable accommodation, we were able to ask a simple question. And because of that, we were able to find someone who wanted those shifts. And therefore, the employer was able to retain their employee, and that employee was able to stay connected to their workplace.
So what do you get with effective disability management? Reduced claim duration, significantly lower long-term disability rates, a reduction in replacement and training costs, and you get your employee back. All of these benefits are proven returns on investment of $5 for every dollar spent on effective disability management. 5 to 1. Not even the most optimistic stockbroker can promise that kind of return on investment. Now, if you're still feeling a little hesitant about applying for the grant to do the Workplace Disability Management Assessment, I can still think of a couple reasons why. First of all, let me say that we're not here to point fingers and to tell people that they haven't been doing their jobs. In fact, the assessment is a supportive and confidential discussion with a consensus-based approach. And the only person who gets a copy of the report is the person that requested it. Or maybe you're asking, how much time do we have to devote to this? Well, the assessment involves phone interviews with about 8 to 12 people, depending on the size of your organization, including both HR and union perspectives. That's it. It's not endless meetings that could have been an email. What you should be asking is this: how is this an opportunity? By applying for the grant and doing the assessment, you will be leading the way to a streamlined disability management process in compliance with federal and provincial legislation, lower LTD rates, and a better relationship with your employees and union. How many people can put that on their resume? But don't take it from me. Let's hear from someone who went through the assessment with a grant to improve their disability management practices.
I'm Catherine Gordon. I'm the Director of People and Culture at Canuck Place Children's Hospice. At Canuck Place Children's Hospice, we try and care for our staff the way we care for children and families. So when we were approached by NIDMAR to do the workplace disability audit, we were super excited because we didn't have the funds as a nonprofit to do that ourselves. So it was an amazing opportunity. And it confirmed that we were actually following best practice, but also identified some gaps that we could do to support our staff even more. The process itself was really easy. So I think anyone, regardless of sector, should be looking into this program, especially as it doesn't require any extra expense. NIDMAR provides the expertise that most organizations don't have internally. With the grant process right there, it's inexpensive to access that expertise to really fully support your staff. So I wholeheartedly endorse this program.
NIDMAR is a world leader in disability management and is offering grants worth thousands of dollars to do a workplace disability management assessment with your organization. Take advantage of this opportunity by going to nidmar.ca and looking at our audit services, or send an email to nidmar@nidmar.ca.
If you're an employer who either doesn't have a disability management program at all, or you do and you're looking to see whether or not it contains all the components it should to give you the bang for your buck that you're looking for, staff retention, cost avoidance, take advantage of the workplace disability management assessment that's being offered. There's no downside. There's grants and things available that there's no cost, and you're going to learn something that you then have the opportunity to make changes that are positive and have incredibly positive outcomes.
Every day, countless British Columbians are injured or become ill outside of work, and they need support to remain in the workforce and return to their jobs when they are ready. The Reducing Poverty Through Early Intervention and Occupational Rehabilitation Initiative is here to help. This program assists individuals in managing their situations and connecting them with the right support at the right time. By stabilizing their circumstances, we can prevent life-changing conditions such as poverty from setting in. Let's look at Alex's story. Alex is 27 years old and works in construction. He recently had a serious bike accident, breaking his leg and shoulder, and he's unable to work until he recovers. Alex doesn't qualify for workers' compensation since his injury didn't happen at work. Instead, he receives employment insurance sickness benefits. But his EI funds are nearly depleted, so he has to turn to income assistance to support his family until he can get back to work. Alex is worried because his bills keep piling up, but his money is running out. Without sufficient income, he faces the risk of poverty, homelessness, or worse. The stress is starting to affect his mental health. This is where the Reducing Poverty Initiative can step in early to help Alex out. The program connects Alex with a Certified Disability Management Professional, or CDMP. Together, they create a plan for Alex to return to work. Through the program, Alex receives fully funded physical therapy for his injuries and mental health support to help him manage the stress caused by his situation. The CDMP also helps Alex navigate the healthcare system, manage appointments, and communicate with his employer about a gradual return-to-work plan. This plan may even include job modifications to ease Alex's transition back to work. His CDMP works with everyone until Alex is fully reintegrated back into his job. With this help, Alex can fully recover and remain employed. He can protect himself and his family from poverty and return to his social life. Alex doesn't become at risk, nor a grim statistic. If you're injured or disabled and need help returning to work, this program is for you. Check our website for the latest details and how to apply. We'll contact you within 2 business days to confirm you qualify and connect you with a certified disability management professional. Your CDMP will work with you to create a return-to-work plan catered to your unique needs, and they'll help you access services and support that you may not be able to afford otherwise. The connection with your CDMP is ongoing, meaning that your CDMP will remain connected with you as you return to work, making sure you have everything you need to successfully stay employed. If you're an employer without disability management resources, we have tools for you too. Visit our website to find policy solutions and training to help support your workers. Cultivating a supportive environment for disabled workers benefits everyone. The Reducing Poverty Initiative is an exciting, innovative pilot program that's constantly evolving. Keep an eye on our website for the latest developments, helping people in British Columbia secure their economic futures. If you have questions or need more information, please contact us.